nobody likes it when somebody comes up to a patient of yours and says, "Oh, nice crowns," or "Nice dentistry, nice dental work." I want people to say, "Wow, you have amazing teeth," and not be able to tell whether they have veneers or crowns or anything. My name is Dr. Tom Brickey. I have been practicing for 22 years, graduated from Oregon Health Sciences University in 1992. Prior to that, University of Utah. I started private practice in 1993 after doing a year residency at the University Hospital. After about 15 years, we decided we needed to up the game. We needed to catch up to the advances in dentistry. So about 2.5 years ago, we decided to expand the concept and sort of expand what we were doing from service mix to taking better care of people. So we changed the name to Natural Smiles Dentistry, which coincides, it fits what we're trying to do here. That's because we want our patients to love their smiles, but we don't want everybody to know that they've had any dentistry done. So we started investing in technology. I wanted to be able to do the latest and greatest on my friends and family, who were all of my patients. I may not be the greatest businessman, but I always said if my mom needed something, I wanted to be able to provide it for my mom. And since we treat all of our patients as if they're family and friends of family, we treat everybody the way I treat my mom.
When somebody asks me about Dr. Brickey, I tell them that it's just a very fun, but yet ultimately very professional operation.
I hear my friends saying, "I hate to go to the dentist. I just hate it." I love to come to the dentist. As soon as I walk in this door and I see Lori or Krista, Brittany, they are simply wonderful.
Our kids love going to the dentist. They love Dr. Brickey, the staff here, they're great. They're never worried about anything that's going on. They actually look forward to it, so it's nice.
So the first time I came to Natural Smile Dentistry, which was 7 years ago when I moved to Utah, I felt like I was coming home.
I met Tom sitting around campfires before I ever met him in the office, and camping and going to Moab and spending one-on-one time with Tom out in nature and at his house. That's what I like to share with people.
Called Tom on the tram and said, "I just lost my tooth, but I've got it in my pocket. What should I do?" And he said, "Hold on to it, take a couple more runs, come down and I'll be waiting for you."
My feelings about this place are that they take care of me. No matter what I got going on, I got a lot of funky stuff going on sometimes, and they take care of it, and it's always fun.
They have this way of communicating. I can't tell you what the way is, but they communicate with one another, and I'm sitting there thinking, did he say anything? Did she say anything? But they've got it down.
My name is Cheryl Brooks, and I am a registered dental hygienist here at Natural Smiles. Well, I've been in dentistry since 1998. I've worked at quite a few practices and feel very fortunate to be here. Both of the doctors here at Natural Smiles put a huge focus on education for our team. We generally, once a year, will look for the best training we can find within the United States, and we'll go as a team and learn what's the newest, greatest, and best that we can bring back and help the community with.
My name is Dr. Laura Provine. I grew up in Pittsburgh. Did all my high school there and then wandered up to Maine. Did all my undergrad up in Maine and then came out west and kind of did some adventuring around out here and got kind of sold on the Western lifestyle. I've been lucky enough to be here for almost 10 years. Spent a little time down in Arizona doing my dental school down at Midwestern University. Brand new school down there, so had the opportunity to have a lot of new technology in my education there, and lucky enough to come back to a practice here that spends a lot of investment in providing the most updated technology care to our patients here.
They're just right on top of it, so I feel like they have the technology here that they don't have in other dental offices.
Starting off with the technology upgrades and trying to get up with modern dentistry was the advancement of digital radiography when changing to that. It's quite expensive, but it's worth it because you cut down the amount of radiation that the patient is exposed to as well as the people in the office. So we've gone to 1/10 the amount of radiation. It's equivalent to an hour outside in the sun. Digital radiography is imperative in modern dentistry. We use it all the time. We don't even have the old-fashioned technique anymore.
I like being able to get excellent diagnostics on folks without having to expose them to a high amount of radiation. We get enough stuff in our lives, so anything we can do to be minimizing that I think is crazy important.
One of the other advancements in modern dentistry today is crowns and restorations on the same day. When I graduated 22 years ago, if you had told me that you could shape a tooth or fix a tooth and have a permanent high-quality restoration, on the same day, I would have told you that that was science fiction and completely impossible.
People are so busy in their lives these days. I really think that, the CEREC technology of being able to mill a crown in a day for you, we get you down to a one appointment visit, with something that used to be 2 visits and several weeks apart. It makes such a big difference just to have someone in for a couple hours and then you don't see them again, they're done.